But today's topic is actually Dr. Solomon. We're going to talk a little bit more about him as a surgeon and some different aspects of his career that maybe we haven't touched on previously.
Well, I'm 56. I've done very little stuff. I've done a little bit of Botox, and I tried one Morpheus and one Pico. I found the Morpheus really, really uncomfortable.
How do you handle the emotional weight of your job?
And I think that certain people graduate residency and fellowship training programs and they still suffer from imposter syndrome. Challenging cases are not the problem. The technical aspects of a challenging case is challenging and actually fun to do. The problem is that the more challenging the case, the less predictable the outcome, even in good hands.
You're good in actually every aspect of life, I have to say. I mean,
Well, I'll take the flattery. She's not
people,
always this nice to me off camera.
I'm not.
So
but
I'll take it. Go ahead.
It's true though. Some people are a jack of all trades. You are a master of so many trades.
Hey everyone, it's Dr. Solomon here. Welcome back to another episode of Unfiltered. Today we were going to do Q&As, but when I asked Nancy, who's here with me, what the Q's were, she said there's no Q's. So I guess just welcome to the A's. We'll get started.
Just answers. I have nothing to do with it today.
Yeah, exactly.
I want to start off by saying your skin. What have you done to your skin? It looks so good. And a patient today just commented about how good your skin looks. Did you do a halo?
Oh, wow. You're right. I did do a halo.
We both actually have done a halo recently because it's midwinter and we just wanted to do something to help our skin look a little bit fresh. So yeah, I just thought I'd mention your skin looks so good.
Oh, good. I appreciate that. Well, I'm 56 and I've done very little stuff. I've done a little bit of Botox. I've done regular microneedling and I tried one Morpheus and one Pico, but I found the Morpheus really, really uncomfortable, but I don't think you guys really froze me.
I have to say that was enjoyable to watch.
I know you found that hilarious. And so if you do Morpheus, you really need to get frozen, or we have nitrous oxide so you can sedate yourself slightly. And the only reason I decided to step it up to the next level, including halo, was I was starting to notice significant changes on this podcast when I was looking at myself of the aging process around my eyes. And we chatted, myself and our laser specialist in the clinic, Afsoon, and she thought that she could go along the lower eyelid area with the halo. And so we did, and it was really, first of all, very easy to do. Pain was easy, like super tolerable, like not even that uncomfortable. But it did take about a week to recover. So I was working throughout the week, but I looked a little swollen, that's all. So a bit more swelling than I expected.
Less peeling, more swelling.
Yeah, more swelling, less peeling.
Yep.
And I do think it enhanced the skin quality a little bit. Yeah, I would consider doing one maybe once a year kind of thing.
I would do it twice a year. I think it makes the skin almost look flawless at the end of that week if from healing, because I did it also, and my face looked like I had put makeup on it, and yours did too. It really made a difference. So I just thought I'd mention.
Okay, well, that's good. Well, if anyone listening is interested in learning more about lasers, energy devices in general, I think we do have a podcast that we talked about all the devices we have, so you can try to find that one or call our office, and we're happy to help answer any questions.
But today's topic is actually Dr. Solomon. We're going to talk a little bit more about him as a surgeon and some different aspects of his career that maybe we haven't touched on previously. So we're going to go beyond the credentials. We're going to talk about you and and the human side of your job. So why faces? Why did you decide to get into a career doing surgery on faces? How does that evolve?
Well, I think like most jobs, it sort of you end up evolving into who you ultimately become. I didn't have a plan to go into aesthetic plastic surgery or facial plastic surgery when I was in medical school. But what I did have was a keen interest in head and neck anatomy. And when you do anatomy, at least when I went to medical school here in Toronto, the anatomy was divided into different regions of the body, and one section was head and neck, because head and neck is quite complicated, intricate, lots of nerves, blood vessels, and muscles. And I just found it really interesting. I also like neuroanatomy. So I think that turned me onto the head and neck. And then when I was in medical school, there used to be an internship year. And that was basically the way medicine worked. Everyone finished medical school, did an internship year, which gave you exposure to different things. And then you applied either to family practice or to a specialty. But when we were going through medical school, they changed all that in Canada, and they said you have to apply to either family practice, there's no internship, or you have to apply to a specialty. And to be honest, it really felt like a lot of pressure because most of us had no clue that we had to do that. We all had planned on just, getting through medical school, looking around at different career options, and then applying as needed. So it changed the whole paradigm for trainees and how you became trained to be a surgeon. So it led to almost like out of desperation, we were all working with different doctors to sort of learn about different specialties. And I was fortunate enough to work with a doctor who did head and neck oncology and facial aesthetic surgery, both within his practice. I also worked with plastic surgeons who were doing hand surgery and body surgery. I was also interested in orthopedic surgery and general surgery. But at the end of the day, the one that seemed to make me most interested and excite me the most was the head and neck surgery. And that linked back to my interest in head and neck anatomy. So I applied to a program known as otolaryngology head and neck surgery, which I was accepted to in Toronto. And that program, depending on where you train, can be heavily focused on reconstructive facial surgery. So at the University of Toronto, I trained in cancer treatments, so everything on the head and neck from salivary gland tumors, skin cancers, tongue cancers, jaw cancers. And so you really, really got a big breadth of understanding head and neck anatomy. And then when I graduated that program, you can subspecialize. And I had already had a huge exposure to head and neck tumor surgery. And I wanted to get more training in the aesthetic type of surgery. So I spent an additional year with a mentor who did a lot of nose jobs and facelift. So that's kind of how I evolved into it. And then for the first over a decade of my career, even longer than that, I did a mishmash of stuff, including always aesthetic surgery, but I did do head neck oncology surgery, primarily salivary gland tumors, thyroid surgery, skin cancer. So I used to spend a few days a week doing that. But I think it actually enhanced my ability to be a good surgeon generally because you cultivate your surgical skills. It allows you to grow, allows you to have confidence, and it improved my ability to take on some of the aesthetic procedures that were in evolution during my career, especially deep plane facelift surgery.
Do you think the aesthetic side of you is the artist in you that wanted to sort of have that outlet?
I think a lot of operations in general are they're mechanical. You go step A to B to C to D, whereas aesthetic surgery is a lot more variable and a bit more creative. So I think that I found somewhat fun, and I think I had a bit of an artistic bent to it. And also, you're operating often on healthy patients. You're dealing with people who are often it's happy surgery, not
Yeah, a
sad
little more
surgery.
positive.
So it's a lot of positive stuff. So as my career developed, it was harder to sort of balance the head and neck tumor surgery and the aesthetic surgery.
I arrived around that time when you were doing both.
When I was still doing both, yeah. You start giving up. When you start your practice, you want to do a lot of everything.
Yeah.
And then as you go through your career, you start having to drop certain things and hyper focus. Nowadays, a lot of the younger surgeons come out and they're geared
Right
into
in.
one direction. But it's tricky to do both financially because you don't necessarily have any patients. And it's also tricky to do in that you're developing your surgical skills. And my contemporaries, the people of my generation, felt that having a mixture of a medical side of their practice really helped them build on their surgical expertise.
It's a good foundation.
It was a good foundation. So there's pros and cons
Yep.
to all that. But that's sort of how I ended up doing facial plastic surgery.
Which procedure did you hone the first?
Rhinoplasty.
And why do you think that is?
I think rhinoplasty patients often are younger. And I think when they see a surgeon who's come out of training and he's in his I was 29, I was particularly young, but in your early 30s, the patients will trust someone in their 30s. An 18-year-old will trust someone in their 30s. But the aging face patients, the facelift patients back then were all in their 60s. They didn't necessarily want to put their hands in a 30-year-old. So things have changed a little bit with the social media and the way people put out their messaging and stuff. But back then, the general trend was that if you were a facial plastic surgeon, the majority of your patients were going to be rhinoplasty for the first decade of your career, and you slowly would add on other, as you built a practice and patients started to trust you, you'd see a patient, for instance, for a nose job, and then the mom may ask about a facelift. So I think that's probably why that operation was the first one. Like we were doing a few hundred noses, 200 to 300 noses a year for decades. There was also a big volume of it, and there weren't a lot of surgeons super focused on rhinoplasty in the Greater Toronto area. There were a handful of us that were doing it. So as the population exploded in the GTA and there were only a handful of us doing it, the guys who were focused on it were quite busy. So it allowed us to have a big breadth of work to build on our expertise and our confidence and things like that. So
Speaking of confidence, when did you start trusting your own judgment?
I think it's a hard question. I think that certain people graduate residency and fellowship training programs and they still suffer from imposter syndrome. They're like, get cases that come to them maybe out of their breadth and depth and comfort level. And many of them will refer them on to maybe a mentor or someone who trained them. And they'll pick and choose the things that they're comfortable with until they grow their surgical confidence and then broaden the surgeries that they're going to provide. An example would be like a complex revision rhinoplasty. Possibly a younger surgeon may want to refer that on until they've done hundreds and hundreds of their own nose jobs and feel confident to keep it on. So I think all of us go through sort of a growth throughout our career. I think some of us are fortunate enough to have had a big exposure in the training to give us confidence. So I felt relatively confident coming out of surgical training just based on the experience that I had at the University of Toronto. So I guess that's a credit to the training program. But I think a lot of the nuanced things I developed over about a decade. So probably 10 years in is sort of where your confidence really starts to peak, that you feel like you're going to be giving patients the best result that's out there possible and be competitive with anyone who's been in practice a long time.
So you're 25 years into your career. Some surgeons at this stage of their career would say, you know what, I don't need to do that, or I'm not going to do that, or I'm going to pick and choose. But what's nice about you is you're still wanting to help people. So somebody perhaps might come to you with a more complex nose concern because they've had a previous rhinoplasty surgery, and it's not every surgeon wants to take on somebody else's work or somebody else's issues. So you will still do that, which is lovely because at this point in your career, you don't have to take on that work, but you want to genuinely help people.
No, I think so. I do. But I will say that as you go through your career, and I'm now in my,
26?
latter third of my career, I guess, as hard as it is to sort of say that. But I'd say, I'm 56. I'm hoping to work still quite a long time, at least another decade or more. You sort of have to also have self-preservation. So some doctors start self-preservation early on. They just don't want a stressful. They're
Right.
going to take on what they call
What's easiest?
easiest cases that they feel they can give the most predictable outcome. And there's something to be said for that. And then there's other surgeons who like the challenge and they'll take on the challenging cases. And the challenging cases are not the problem. The technical aspects of a challenging case is challenging and actually fun to do. The problem is that the more challenging the case, the less predictable the outcome, even in good hands. So there's some surgeons who the whole practice is complex revision rhinoplasty, for instance, in the United States, and they're technically amazing, but they may have an online presence which looks like they're terrible because they're taking on the most complex cases out there. And so there's an element where that may sort of make it harder to sort of want to be as surgically charitable, I guess, and you want to start being a little bit pickier. I had a lady in today who wants a facelift who told me she saw 3 other surgeons in consultation and was told not to do a facelift, even though I think she's a perfectly good candidate for it. And I think it likely had to do with the interaction that took place, that the patient, I told her that likely something went down in your conversation that made the surgeon maybe a little bit reluctant to do it.
And you didn't see any of that in your consultation with her?
I did a little bit, but I think ultimately it's a bit of a judgment call. I felt that she was realistic and a nice person and someone I'd probably be willing to work with. But I did have a little bit of an awareness that possibly she might frighten someone off just based on the types of questions she was asking initially. So I'm speculating. I'm not sure. I wasn't there for that consult, but sometimes you misread people. They may just be asking a very curious mind and asking lots of good questions. I think it's when a patient sort of almost asking for certainty guarantees, which may be anxiety driven, and we can't give them that. And then if they're not comfortable not hearing that, then it's best that we don't do it, even if they're a good surgical candidate. Patient has to have acceptance of the fact that this is not 100% predictable, even in expert hands. And if someone doesn't accept that, it's better not to go down that path. If a patient has a complicated case, but they're realistic, um, easy to work with, collaborative, then I think most people would want to help that person.
My next question is sort of on the heels of that. How do you handle the emotional weight of your job?
Well, I think any plastic surgeon or facial plastic surgeon or aesthetic dermatologist would be lying if they basically put out that it's always perfect, because we deal with a lot of patients who have a lot of emotional baggage that they may bring to the table. They have a whole life that they've lived, and while probably I'd say 80 to 90% of the patients are very thankful and they're coming and almost like thrilled with the results. And you see, we showcase some of our patients. We have hundreds and hundreds of happy patients. There's always going to be some patients that are more challenging. And it could be that the surgery didn't turn out how they had hoped, like the expectation and reality, math didn't work out in their favor, even if they have a reasonable outcome. Or something sometimes else is going on in their life. They may have a lot of stress that we're unaware of. They may have emotional turmoil. They may be having a hard time sort of just recognizing themselves. Body image things may be hard. And so there's a lot of psychology that plays into it, which is difficult sometimes because we can't always manage it. Sometimes we seek assistance of family doctors, psychologists, psychotherapists, psychiatrists. It's rare, but sometimes it's helpful, like especially if a patient's getting like deeply depressed or anxious during the perioperative phase. And then people ask the common question, well, don't you screen for patients? Don't you of course we screen for patients, but even with best screening techniques, it's sometimes difficult to be certain. Because we have some patients who have all sorts of like red flags, we'll say, preoperatively. They may be on psych meds. They may have had depression, anxiety in the past, and they sail through the operation with no problem at all, and they're totally reasonable. Then we may have someone with no flags at all, be a disaster after surgery, having a very hard time emotionally. We heard from the patient that we talked to earlier today, who is a very balanced, mature woman. She said she was sad for a few days during the healing. So I think there's a lot of emotions that get sort of triggered, I think. So that can be a huge challenge in general.
Well, facial surgery compared to body surgery, I mean, it's people's faces from here up. You can't really put a bag over your head and hide anything that you may not be happy with. Or during the healing process, there's swelling and there's asymmetrical swelling, and it may not look exactly as you planned. It is a hard process for people, but some people sign up for it with confidence and they are able to endure the process, and that's great. It's good for them. So when you are out in the world as Phil Solomon, do you have a hard time not seeing the imbalances of people, friends, people you see out in the world? Like, are you surgeon first, or are you able to just see people as they are? Or are you sort of assessing the face sometimes?
It's a good question. I haven't really thought about it, but I think in general,
I've thought about it, and I'm not a surgeon.
I think that we're likely more critical in assessing things on patients' faces than the average person.
Yeah. Which I don't like to be. I don't like to look at people from that lens, but sometimes you wish they maybe knew of something that we offered that could just help give them a little bit of a perk. Or
well, that's the lens that I'm talking about. Sometimes
Yeah.
you'll see someone that you're with and you're like, well, you'd look great with just a little bit of Botox in your crow's feet, or oh, you know what, if you had a little bit of volume added here, or maybe it's time for you to get a lower blepharoplasty and you'd look super refreshed, or the jowls in your neck are starting to look a little bit aged and potentially you could consider a facelift. So all of those go through my mind, but I wouldn't say it's like the primary thought that I'm walking around constantly judging.
Well, it's like you don't want to be at work.
Judging people.
Yeah.
I think I'd turn it off, but I think I just have an awareness of it. Probably a bit more heightened. But I think even non-physicians nowadays, because aesthetic medicine is so out there in social media and people are reading about beauty, almost everyone in society now who has an interest in aesthetics, which is pretty much everyone, becomes sort of hyper-focused and critical of their friends and their family. We have people come in who are not trained at all, commenting on the result of a facelift I may have done on their mother, and like, well, couldn't you have done this or that? And I'm like, and the mother's thrilled with the result, and the daughter's like, couldn't it be a little bit more tight, or couldn't it this? And it's just interesting how they feel the comfort to sort of weigh in on it.
Do you find that hard though, if someone comes in after like a family member weighs in, the work that went into that surgery? Like, do you take that personally?
I try not to. I think if someone brings up a valid point, I try to step back and listen to it and actually answer it in a sort of a professional manner and not be defensive, because it's very easy for physicians, and we hear patients complaining, "Oh, I saw this other doctor and they're very defensive." And so there's a natural tendency to be defensive if you're put on the defense, if the patient's being aggressive about it.
Right.
If the patient's inquisitive and just asking legitimate questions, it's our moral and professional obligation just to be truthful to them and tell them. So if someone has a little bit of residual like laxity in their neck and they show it to us, I'm not going to take that personally. I'll say that can occur, and sometimes we have to go back and do a touch up. Or if someone's had a rhinoplasty and they have a deviated septum that's not completely corrected, or their nose seems to lean one way or the other, that's sort of a natural phenomenon that can occur even when rhinoplasty is done perfectly, because the cartilages can sometimes bend and warp as a result of surgical intervention. So whether the patient accepts your explanation, that's where sometimes it can be a bit difficult. If someone's challenging you or thinking that you're not being forthright and open and honest with them, then you get defensive a little bit.
Do you think people are harder on themselves now?
I think so. I think, the whole Zoom boom thing, I think people are looking at
Zoom
themselves.
boom.
Yeah, Zoom boom
Yeah.
people are way more critical and aware of things than before, which has
Yeah.
fed our industry a lot. It's been a force in a way that's driven people to consider aesthetic treatments more than before, where people, other than waking up, brushing their teeth, looking in the mirror and combing their hair, no one was analyzing themselves. Nowadays, everyone's looking at themselves nonstop on phones, on devices. So certainly people are definitely more aware, more critical. And then the other side of that is that a lot of the images that they're seeing themselves are not 100% accurate and may distort
I love this
or exaggerate.
explanation.
Well, they exaggerate some of the imperfections. So that could be, that could be bad.
Give
in that-
your photography, everyone's looking through a lens, which isn't real. Real
Right.
is me looking at you, you looking at me in front of each other, three-dimensional, but the lens of a camera isn't real.
Yeah, the lens of the camera, depending on the camera, is trying to simulate as natural image as reality. But there's a whole science of photography, and iPhones certainly, while they capture beautiful images with lots of, the pixels are amazing and things like that, they may, depending on where the camera, first of all, it's a singular lens and the lighting can be different and the angulation of the image can be different. So it's very hard if patients are focusing on their own selfies because they may be distorted a little bit.
So if you weren't a facial plastic surgeon, what would you be?
I don't know. I think
Besides on a beach.
on a beach somewhere. No, I'm too ADD to sit on a beach.
Yeah.
But I actually thought of being an architect when I was younger, and I think that probably would have been a very good job for me. I think I would have really enjoyed the creative side of it, the design side of it. Something with building, architecture, design probably would have been a good fit for me. Yeah, I don't know. I sometimes think some of these, I have friends who are in finance who say that I would have been good at investment banking.
You're good in actually every aspect of life, I have to say. I mean,
Well, I'll take
some
the
pe-
flattery. She's
some
not
people-
always this nice
I'm
to me
not,
off camera.
I'm not.
So
But
I'll take it. Go ahead.
It's true though. Some people are a jack of all trades. You are a master of so many trades. You know so much about so many different categories of business. You do. You're amazing that way.
Well, thank you.
You're welcome.
The friends of mine who suggest that would have been a good career are friends in that business, and I think that business likely has to do with communication style on dealing with people. So maybe they're giving me a compliment that they think I'm good at that. So
you
maybe
are.
that would have been a good job, and I'd probably be retired already. So
Well, for me, I'm glad you're not. At the end of a day of surgery, how do you unwind and reset, just so people can get a little more insight into you?
Well, I try to keep very active and be physically fit. I think it's important for this job to actually be fit. I think it's a job that if you don't keep your body healthy, it's hard to deliver on the long procedures that we carry out. So I try working out. I was playing a lot of pickleball for a while in the last few years, and I was really enjoying it, but I have pickleball elbow, which is really not fun. I'm having a hard time managing right now. So I'm off pickleballs, but working out, yoga. I bike a lot in the summer. As people who follow us on social media will see that I'm often biking somewhere. So I think that's important. If I'm in a lazy mood, I'm watching movies on the couch or YouTube videos with a glass of Amarone and chocolate almonds. That's
And
my
that's nice. Your
that's my
vice.
that's my vice. Yeah.
Your vice. And how do you want to be remembered?
I don't know. People say that you want people that you've had an interaction to have positive memories of you. I don't, it's hard for me to think of it as being remembered other than from family. But I will say that my dad passed away a few years ago, and I still have people coming through my office who knew him. And it does make you feel amazing when someone says something kind about
Oh, yeah.
your parent,
Hmm.
your father in particular, and so it resonates. So I think if you can, be a good person, put in your maximum effort, deliver the best results you can for people, be kind, be honest. I think that's how you want to be remembered.
Nice.
Well, that was a lot and reflective, and I appreciate all the questions, and I hope you guys found that interesting. I'm not sure you did, but nonetheless, I think it was a bit of a catharsis, I guess, for me. So thanks for putting those questions together, and
No problem.
we will see you again shortly in another episode of Unfiltered.